My name is Dennis Kilama. I'm from Yotkom Medical Center, one of a private not-for-profit organization who is providing healthcare services in Kitgum, and they are found here in Kitgum Municipality in Panduong Division. And today we are taking you to Yotkom Medical Center to interact with the staff and the patients who are receiving care there, so that we are able to understand the nature of healthcare coverage in this region.
My name's Andrew Wright. I'm a medical doctor from Australia. I first came here to Northern Uganda about 20 years ago in 2001, and I encountered Kitgum in Northern Uganda. And as a medical doctor and also as a Christian, coming here had a deep impact on me and also my wife, who was with me at the time. We saw the level of suffering and the lack of medical services that were confronting the community here in Northern Uganda. When we came, there was a civil war here, and there were many people struggling due to civil war from trauma, and the community was lacking trained health professionals, and there was no established quality health facility in the community. So since I was a medical student, I've always had an interest in African healthcare, and it's been my vision to at some time in the future spend some time and energy helping our neighbours here in Africa to build better quality health services. And I believe as Australians we have a great deal of capacity to assist people in overseas countries to build better health services. So my wife and I set about setting up a charity organisation called Yotkom, and our goal was to partner with Ugandan medical practitioners and work together in partnership to help create better quality health services and also make them accessible to the community.
I am Omar Peter, the Administrative Director of Yotkom Uganda.
My name is Richard Kidega. I'm one of the directors of Yotkom Uganda.
I'm Dr. Charles Abonga Lagor. I'm the Medical Director of Yotkom Medical Center.
My name is Emmanuel Olal. I'm a medical doctor by profession, and I also have a specialty in public health.
I'm Sheila Gloria Mara, a vaccinator at Yotkom Medical Center.
I'm called Dr. Matthew Roma. I'm a medical officer. At Yotkom, I run the emergency department as the in-charge emergency medical services. It includes the ambulance service.
I'm Dr. Julius Abonga, orthopedic surgeon in Yotkom.
My name is Dr. Felix Onyango. I'm the head supervisor of surgery department at Yotkom Medical Center.
I am called Reverend Consia Migo, the chaplain of Yotkom in Uganda here.
So that's our vision, to partner together to improve access and excellence in healthcare in Northern Uganda.
I think that with increasing demand for our health services, we need to expand to provide secondary and tertiary related health services. And that means constructing more facilities. That means recruiting more highly qualified and specialized medical personnel.
Our goal is really to build relationships, Ugandan health workers and with the community here in Northern Uganda, cooperating together to build the best quality health care services that we can. And secondly, we want to join together to build more resources. So here in Uganda there's difficulty sometimes getting medical resources, so quality x-ray machines, laboratories that are well equipped, and also just building structures like hospitals and medical facilities. That's really one of our key goals in terms of building resources here in Uganda.
In terms of space, we don't have enough to admit as yet as of now.
On average, we see about 350 patients per week, and sometimes more.
With the good leadership, good accountability, good financial accountability to our donors, we believe we are so much trusted by our donors because the way we have developed and the rate at which we have developed our services to the community, is actually so good, and our services are so demanding. In the whole of eastern part of Acholi sub-region, we have only one orthopedic surgeon. We're serving over 7 districts in the northern part of the district of the country. And therefore, it is our humble appeal to well-wishers and then any other donors who would wish to support us in our dream to partner together to improve access and excellence in primary health care in Northern Uganda, as envisioned by Yotkom Uganda.
We have a challenge of qualified human resource who are willing to remain in this part of the country. A number of times they demand higher salaries than the organization is able to provide. Like in the Department of Laboratory, in Radiology Department, in dental services, it's often very difficult to attract and retain highly qualified medical personnel. We also need partners who are able to continuously subsidize some of the costs of the services we provide. Like, for instance, if we can provide free healthcare services to children, to women, and very subsidized orthopedic-related services, we could go a long way towards the realization of our dream of expanding the access to health services in Northern Uganda.
We want to see the facility here grow in its capacity to be sustainable. So we're keen to build strong leadership here, to mentor leaders and to see them rise up and be able to administer a hospital facility like this. Today we've got a little baby called Matthew. He's 7 months old and he's come here overnight with severe breathing difficulties. He needs oxygen. He's got a high temperature and our doctors have diagnosed pneumonia and started him on intravenous antibiotics, and he's also requiring regular nursing care and oxygen. And now here in Northern Uganda we're seeing increasing numbers of non-communicable diseases like diabetes, high blood pressure, stroke and heart disease. And we employ over 75 Ugandan health workers and support team here at Yotkom Medical Centre. We are seeking to employ local health workers to also help them with ongoing education and training. We sponsor students to go and further their education. At the moment we've got students studying radiography, physiotherapy and medicine. And here at Yotkom we have a chaplain that we employ. Her name's Reverend Consi. She is involved in counselling and chaplaincy. Our goal is sustainability and self-reliance, so we do have a fee for service that we are charging for the community to access the health facilities here. That covers about 70% of the running costs of running a facility like this, and the remaining 30% is coming from generous donors in Australia and overseas who give regularly to this facility to help us keep our fees low to the community. Even so, there are many patients here who are at the extreme of poverty, and we have a compassion fund here that we've set up so that we can offer free and subsidised health service to the most disadvantaged in the community. And through our compassion fund we've been able to help a lot of individuals, children and adults who without our help would not have been able to access curative health therapies. So we're very happy with our compassion fund and we thank those donors who give specifically to that need.
In this aspect, Yotkom decided to look for people who are able to go to school and study in specific areas of need of the facility. I have had the opportunity to be sponsored to study a bachelor degree in medicine from the institution of Gulu University. Also have had students like Joan. Joan is now working with us in the area of palliative care. Colin Zoroma, who is being sponsored in Lacho, is pursuing his studies in anesthesia. Daisy, who is studying from Kampala in Mengo to become a radiographer. We also have Isaac Opoka, who is studying in Mulago, pursuing his degree in physiotherapy.
And we really appreciate the partnership that we have with Australians. There are many donors, supporters and encouragers back in Australia who really get behind us. They've helped us to build this hospital facility behind us. So much of that is really due to the partnership we have with Australian and other overseas donors.
Get it.